Welcome, I'm Dr. Tania Heller. Today I'll be talking to Dr. Morad Tavallali, a renowned board-certified plastic surgeon in the Washington, D.C. area. He graduated from Georgetown University School of Medicine with honors, then trained in general surgery in New York and plastic and reconstructive surgery at Baylor in Houston. Dr. Tavallali also completed a year of advanced fellowship in Europe before setting up his practice in the D.C. area. He's certified by the American Board of Plastic Surgery, is the author of several articles published in leading journals, and has been widely featured in print and on television as a cosmetic plastic surgeon. I wanted to ask you, do you remember when you first made the decision to pursue a career in plastic surgery?
I actually do, surprisingly, and it was when I was about 12, which meant that I had no clue what plastic surgery actually was, but I knew that I'd done well in a science project at school. Everybody had told me well done. I then did very well in an art project, and somebody said, oh, you should become a plastic surgeon, which is the combination of the two. And I thought I was going to go to art school. I had no idea that I needed to go to become a doctor to do plastic surgery.
To speak to that, I was going to ask you, you have such good fine motor skills as a plastic surgeon. I was wondering what kind of activities you enjoyed as a kid.
I think any surgeon likes to work with their hands, no matter what it is that they're doing. So I used to play the guitar, and I used to do that to get better skills. And then in college, I was also a fine arts minor, so I did a lot of sculpture also, and that is just part of that wanting to work with your hands.
Was there someone in particular who inspired you to go into medicine?
There was a friend of my mother's when I used to live in London, who was a plastic surgeon, Lady Claydon was her name, and she actually was the one who encouraged me at that point. She said, this is a fun field in medicine to go to.
I was always wondering if there's certain people who are more suited to certain specialties. For example, career in emergency medicine versus surgery.
I think there are, yeah. I think, all of us have different personalities, and I think all doctors have different, we're all human and all a little bit different. And although we all want to help others, I think our own personalities do come into it. So surgeons tend to be a little bit more wanting to work with their hands, being a little bit more interventionist. Neurologists I always think of as being more cerebral and more puzzle solvers. Orthopedic surgeons obviously like bigger type of surgery.
We're so inundated with media messages now about the way we should look and even how to avoid looking old. I worry about how that affects some of the young boys and girls who may be more vulnerable to these messages.
I think that is a very important thing that we need to watch out for. I remember when I first started my practice, this young lady came to the practice for a consultation, and showed me the centerfold of a Playboy magazine and said, I want to look like that. And I looked at her and I said, I'm sorry, that's impossible. She said, no, that is me. It was a picture of her, but it had been so airbrushed, so changed that she wanted to look like her image of herself. And I think that is something that obviously we see a lot of here, where people see celebrities, this and that, they see those photos, they don't see the real person, and everybody wants to achieve something that is just not possible.
But you find some people who are just not good candidates for surgery. How do you make that determination?
It's difficult. You have to talk to the patient, you have to establish a relationship, make sure that they have expectations that are realistic, showing them pictures of patients like them before and after to see if that's something that is what they expect. But surgery and in any type of illness, including cosmetic surgery, will touch onto the emotional aspect of us, and we all will react in different ways.
Do you have any advice for patients to improve the relationship with their doctors?
I think the important thing is, trust your doctor. That's the number one thing. You spend time to choose that doctor, you've gone to many consultations. Once you find the doctor you want to take care of you, trust them. And then listen to what they have to say. Don't go second guessing them. Or going off to get advice from the internet and stuff like that, because you trusted that doctor to operate on you, you should trust them to take care of you the rest of the time too. And of course, be truthful to your doctors. make sure you tell them the truth.
Do people withhold a lot of information?
I think they do, because they know, they've read that if you are a smoker, for example, the doctor may not want to operate on you. So they will withhold the information, and that always ends up being to their detriment.
And any advice you have for students wishing to pursue a career in surgery or plastic surgery?
Sure, I think it's a very rewarding career. It's been a lot of fun. I've been doing it now for maybe 30 years since I graduated, 31 years since I graduated from medical school. So, and it's been a lot of fun. On the other hand, it is a demanding career. For most of your 20s and 30s, you're going to be working and studying, and while the rest of your friends who are in other things are running around doing other things. So I think there is a little bit of sacrifice that goes into it, but the reward is in being able to help people and do something that you love.
I remember in medical school actually sharing an apartment with 2 other students and having to line my room with egg cartons to keep the noise out while they were partying and we had to study. That was a while ago. I wanted to ask you a little bit, any regrets about entering this field?
No regrets at all. I often think about, what else would I have done, and maybe if I hadn't become a doctor, I would have become an architect, which is still similar in terms of changing things, intervening in things.
Right.
But no regrets. I just wish that I'd known a little bit more about what a medical practice, and I've been in a solo practice all my life, entailed. There's the whole business aspect of it that I had no clue about at all. I'd never taken even an accounting course. So I thought that I wish I'd known a little bit more about that before starting my
more and more doctors
practice.
taking MBAs and studying business, aren't they?
Or ending up working for somebody so they don't have to deal with all the daily rigmarole of running a business. So they just get a salary.
Anything else you'd love people to know? You wish
Well, I think,
either patients would know or students would know?
I think plastic surgery is a very exciting field. It's one that will keep on evolving. It's a relatively young field in medicine. It only started after the First World War, so it's still only about 120 years old or so. But I think there's a lot of innovations in the future. It will keep changing.
Dr. Tavallali, thank you so much for your valuable insight today. I'm Dr. Tania Heller, and I look forward to exploring other fields of medicine with all of you in the future.